My name is Clement Johnson from Lamar University, and this is my capstone and 5-year plan, Nursing 4580 course, Synthesis of Professional Nursing by Dr. Nancy McAfee. I was born January 10, 71, currently resident in Rosenberg, Texas. I'm married in 2015 with 3 children, all girls, Abigail, Annabelle, and Brianna. I became a licensed vocational nurse in 2005 from the Lamar College in Port Arthur, Texas. Also got my associate degree in nursing 2009 from Excelsior College, Albany, New York City. I'm currently pursuing a baccalaureate degree. Hopefully we'll get it in December 2018. This is the last class in 2018 from Lamar University. Currently employed at Memorial Home and Hospital in Houston, Texas. Humanity and Society Construct number 1. This student learning outcome here is about practicing safe and effective holistic patient-centered care to a variety of patients and clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This we are able to achieve through 3 classes: Nursing 4316, 4540, and 4620. 4316 dealt with the health and physical assessment in multiple health settings. This we are able to achieve by using the shadow health assessment simulation lab. Have different patients, different health scenarios, did assessment head to toe, listen to their heart, their lungs, and this help us in meeting this goal. 4540 open up my eyes to the global problems inherent in societies. As we saw in the video from YouTube about Bangladesh water system in urban areas, in urban slums per se. Nursing 4620 introduced us to the evidence-based guidelines and protocol, how to research and get evidence-based protocols, like what we have in catheter problems and in vent problems. All these help us to get a full outcome at 88%. Lifespan Health Continuum Construct number 2. This supports patients' clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Nursing 4620, we have discussions number 3, 4, and 5. How we care for patients with heart failure, compromised neuroendocrine gastrointestinal conditions, also patients requiring ventilation and sedation, traumatic, compromised immunity, and end-of-life system. We also watch videos on systemic inflammatory response syndrome. All these were discussed, and this helped us meet the goal of supporting our patients and clients. We also read a book about Paul Goddard, Before My Heart Stops. This is about the struggle of a man that had a heart problem right from childhood, how he got heart transplants, everything he went through, his faith and belief in God and his family, and how they thought about the end of life. All this help us meet the student learning outcome at 85%. Lifespan Health Continuum Construct number 3. The goal here is to evaluate patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromise multiple health needs and compromise multiple health states when considering multiple determinants of health. 2 slides here, or let's say 2 classes, 4540 and 4580, help us meet this goal. In 4540, we had a module of 4 that is called the population that need health interventions. The practical project emphasized on our neighborhood, and windshield survey investigated the health and safety needs of my community. Rosenberg is a small place, but we have people from different parts of the world, even here, most without insurance, most without health knowledge. This brought to light the health problems among this population. NURS 4580 class narrowed the complexity of the health needs and compromises to 2 stories about Lewis Blackwell and Baby William. These are really sad stories, but they help us achieve this goal. The student learning outcome here was fully met in the above 2 classes with 88%. Evidence-based practice and clinical reasoning construct number 4. This synthesizes clinical reasoning and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. Nurse class 4321 and 4390. 4321 dealt with nursing theories and online education. In this aspect, we discussed the different theories of people like Newman and Nightingale and ORM and the relationship between these philosophies, models, and theories. 4390 brought about nursing inquiries and evidence-based practice. They will critique quantitative research report. How we derive at this quantitative research report with asking questions that help us arrive at evidence-based theory. Learning outcome here was fully met at 85%. Construct number 5 is patient-client centered care. The goal here is for us to employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and clients and members of the interprofessional and intraprofessional healthcare team. Nursing 4321, we had to do with the differentiated essential competency paper. This brought us to collaborate with different parts of nursing. And 4316, we had a comprehensive holistic health assessment where we utilized the shadow health assessment assignments and discussions on different people that have different illness, people that have chest pain, abdominal pain, and all different kinds of problems. All this help us attain the student outcome. Professional roles construct number 6. The goal here is to differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and clients as a member of the interprofessional and intraprofessional healthcare team. The nursing class 4550 brought us to talk about the nursing practice, the leadership, and management in healthcare system. Here we also use the Texas Board of Nursing website. The goal here was fully met. We discussed the different roles that nurses can play in management, how to be a charge nurse, what a charge nurse does, what the floor nurse does, how do you relate to patients who have been problematic. All this help us meet the goal fully. Professional roles construct number 7. The goal here again is to demonstrate professional integrity, effective communication, active inquiry, and service to the community. What else will tell us this? But NURS 4540 class, where we had a care of the community and the civic pride and diversity initiative assessment or assignment. We had a video on disaster preparedness and assignment, and also the windshield survey. Once again, we are in contact one-to-one in the community, asking questions, helping them get prepared for the hurricane that happened a year or two ago. All this help us provide service to our community. This student learning outcome here was fully met at 93%. And what's my 5-year plan as a nurse? Finally, we want to obtain the BSN in 2018, December, in a couple of weeks. For 2019, I want to be have obtained my certified medicine nurse certificate. By spring of 2020, I want to be enrolled in the class for my family nurse practice, and by 2022 be enrolled for the MBA program, and 2024 have my own practice. And the references are all listed here with the ones from the shadow decks, the nursing professional issue nursing book, the Lamore handbook, the Texas Board of Nursing, and also the book by Paul Cadell. Thank you very much.